situation. Good morning, dear friends from the media. First of all, I will brief you on the latest numbers of COVID-19. In the last 24 hours, we report 38 new cases, which adds up to 308 cases as a total, and 6 in severe conditions. We have 1 area of high risk and 75 areas of middle risks. And we have quarantined the confirmed patients and their close contacts. First of all, we have carried out the 4th round of nucleic acid test, and we have set up 414 sampling locations. The local residents need to carry their ID with them to receive sampling. Up to 8 o'clock today, a total of 1.58 million people have received the tests. And second, we have been improving the treatment on the patients. And Dr. Su Yusheng from the Subei Renmin Hospital is leading a special medical panel to improve the efficiency and strengthen the guidance on the treatment. And currently, 158 cases have been received, and we have renovated the number 5 hospital in Yangzhou hospital. And altogether, there will be 50. It will provide 53 hospitals. And the renovation plan of the number 4 hospital building is receiving the verification of the jury of the panel. We want to remind the local residents to strengthen self-protection, wear your mask, keep social distancing, and personal hygiene. Now the floor is open to questions.
我是扬子晚报子牛新闻记者，我想请教一下
With
咱们扬州
Yangzi
生态科技
News.
新城的相关负责人啊，在咱们城区防疫一盘棋
We
的
want,
这么一个
my
背景
question
下，
goes
生态
to
科技新城是如何
the
做好辖区防疫
spokesperson
管控
of the tech new area, the new city. So can you tell us more about COVID-19 containment in the tech new city? The COVID-19 containment work in Yangzhou city has become a national concern. And in our new area, we in our new area reports 0 new cases at this moment. And we have been adjusting our policies and formed 10 working groups to carry out the supervision on the 3 tiers of protection network and strengthen the daily report system in order to reduce the risk and strengthen the supervision system to make sure that all of the policies are implemented. Second, we use the big data and group management system to carry out screening processes, and the system works 24/7 to make sure that no one is left behind. The community workers are working at the front line to screen the local residents to find possible situations, especially the migrant population, so as to provide the statistic basis for the COVID-19 tests at the local level. We have also organized special personnel to report, to carry out the investigation and report. We have closed the entrance of the East Station in Yangzhou City. We have set up more than 100 sampling spots to do the nucleic acid test. And the whole process has been streamlined. And we satellite screen channels for the senior citizens. We have established a very timely statistic and report system in order to quarantine the confirmed cases and their close contacts. And we have organized special personnel to ensure the quarantine situation. The party members are working at the front line of the pandemic containment. And we have also carried out educational work at the local level to improve the crowd's awareness and answer to the concerns of the local people. With CMG, my question also goes to Director Tang. So how do you ensure the daily necessity supply? We attach great importance to the supply of the daily necessities. And first of all, we need to stabilize the supply and to make sure that the major providers, the supervisors, will strengthen their the storage and logistics of the major supermarkets, and expand supply as much as possible to expand the sources of supply and to make sure the abundant supply of daily necessities. Second, we ensure special license to the transportation vehicles that to transport necessities and groceries, so as to ensure the needs of the local people. And three, we need to ensure the transportation of the medical supplies, including the PPEs, the masks, and other disinfection supplies. We work with the local medical facility providers to ensure the supply of this equipment. And we have also strengthened the transparency of the supply, transportation, and distribution of the medical resources. And fourth, we have made contingency plans. Once the control measures is upgraded, we will ensure that the people in the closed down neighborhood can have access to abundant supply. The community workers have received trainings to improve the quality of their services and provide special services to the residents with special medical and life needs. For the local residents with special needs, including the poverty-stricken household, we would provide special services to them to ensure that they have access to enough daily necessities and COVID-19 tests. For Xinhua News Agency, the city of Yangzhou has issued a special notice on the COVID-19 containment in the waterways, especially in harboring areas and the water transportation channel. Mr. Yan, thank you for the question. Yangzhou is known for its well-developed waterways and has two major waterways, that is the Great Canal and the Yangtze River. The boats from more than 10 provinces would travel through into Yangzhou, into and out of Yangzhou through these waterways. So our measures, including the following 4 parts to improve the COVID-19 containment in the waterways. First is to strengthen the control measures. All the boats inside the city and their crew are prohibited from going out of the boat to go to the cities, and all the boats have stopped operating, except for the daily necessities such as and major raw materials such as coal and oil. All the harbors have stopped working and the harbors have been closed down. And the workers in the harbors are staying in their working positions. And second, we have carried stringent measures in terms of shipping. We have set up 7 checking spots to screen the boats on the waterways, including their ashore and offshore reports and AR system, so as to make full coverage. We're working with the Public Security Authority to check the ships that comes from high and mid-risk areas and the crew. And for the personnel with the red and yellow health codes, we will carry out quarantine on spot, but so far we haven't discovered this kind of cases. Third, we work with the CDC and Health Commission to carry out administrations of the people and personnel and workers working in the trading areas, especially those that deal with foreign goods. We carry in-time and frequent COVID-19 tests for the garbage and sewage of the international ships. We separate the management area and channel with those domestic ones. We have also planned the 3 areas, that is the contaminated area, the buffer zone, and the safe area. For the ships that come from the high-risk area, we have very tight measures of controls. For the ships that do have to come into the harbor, they need to have with them the nucleic acid test results with them within 48 hours. We have also improved the efficiency for the shipping lanes and open up great channels for those with necessary raw materials. And so far, no new cases have been reported that is transmitted through the waterways. However, faced with this very severe COVID-19 containment situation, we have to keep up the good efforts to prevent this COVID-19 from spreading through waterways. I also want to remind once again our residents to avoid travels at this special period of time so that we can win this battle in the end. My question goes to the medical professional. Since the report of the new cases, we have carried out 4 rounds of COVID-19 tests. So can you tell us more about this activity? I think people are very concerned with work at this front because there is one high-risk area and more than 70 mid-risk area. So within these areas, there is possible community transmission at the community level. So these are the key population for multiple rounds of COVID-19 tests. And second, this comprehensive test is an important measure to contain the spread of the virus. The COVID-19 virus would have a certain time for this kind of a virus to spread. So it will stay down and stay for some time before it can be tested. And during this kind of incubation period, the virus may not be tested. That's why this kind of multiple rounds of test is necessary. So it has to be a dynamic process. It will not be possible to screen all the infected patients or source of infection within one round of tests. Even if you received multiple negative results, to carry out more targeted and early detection and cut the channel of transmission, multiple rounds of nucleic acid test is a must and a necessity. Last but not least, I would want to remind our city residents of the following points. First of all, before departure, to avoid vomiting, do not eat food 2 hours prior to the test, and avoid drinking water or beverages 30 minutes prior to the test, and also smoking and chewing gums. Carry your personal ID with you and wear the mask properly. Try to avoid public transportation as much as possible and stay in queue, and avoid conversation and keep social distancing at the sampling spot. And relax when you're taking this, when you are being taking samples. Do not cough or sneeze. And we suggest that you switch to new masks after sampling. and to avoid spitting or vomiting around the sampling area. And right now, we are at the very hot summer, and make sure that you listen to the instructions of the local workers, community workers. We aim at finding the possible sources of infection through multiple rounds of tests, and to ensure the safety and health of the local residents. And we look forward to your cooperation and support. That's all for the Q&A session. If you have more questions, you can contact us after the press conference. That's all for today's conference. Thank you.